Good morning, all the students and my listeners. Today, I discuss with the disorder of purine metabolism. In the previous class, we discussed about the purine biosynthesis and their regulation and use of synthesis of DNA. But here, what are the metabolic disorder? If the any abnormalities are occurred during the biosynthesis of purine, there is some disorder will be occurred. And what type of disorder will be occurred? Then discuss. First, the disease associated with the defects in the purine metabolism. If the purine metabolism is proper, there is no problem. There is no problem. There is no chance. But if there is a chance, if there is some metabolism problem of purine nucleus, there is a chance of so many disorder or diseases. First, hyperuracemia. That means increase the uric acid level in your body. Another is the gout. Is another most important inflammatory disorder, autoimmune disorder, or sodium salt of uric acid. This gout, Lessons, Nehan syndrome, kidney stone, and severe combined immunodeficiency disorder, ACID. So these are the 5 types of important disorder caused by the purine abnormal metabolism of purine: hyperuracemia, gout, Leishman, Nehan syndrome, kidney stone, and severe combined immunodeficiency, ACID, due to abnormal metabolism of purine. So first, hyperuracemia. What is hyperuracemia? That means hyper means always increase, and urea means uric acid, and catalyze the plasma uric acid level is greater than 7 mg per dl, and the normal plasma level in case of female 2.4 to 6, and in case of male 2.37. If the uric acid level more than 7 mg per dl, it is called the hyperuracemia. And in case of hyperuracemia, there is so many problem occurs in your systems. The first, primary hyperuracemia is an innate, that means natural process defect of the purine metabolism, and the uric acid is excretion. And secondary, increase the availability of purine due to the medication or medical condition or the through diet. If the excess amount of purine coming from the diet or degradation or some medication, then there is a produce some secondary hyperuracemia. Another is the gout. This is also picture. Gout is caused by the precipitation of sodium urate or sodium salt of uric acid, which is deposited in the joints, basically joints, and this is first produced a crystal in the joints, resulting in the inflammation, and finally the pain will be occurred. So listeners, please listen it. Gout and rheumatoid arthritis totally different. Arthritis is the main RA factors, immunological factors, but gout, which is caused by the uric acid level, and if you can prevent it. Sometimes diet also can control the uric acid level also, because to control the purine level in your body, the gout, and there is a problem. Generally, this uric acid, which is deposited in the joints, the movability of the joint can be reduced, ultimately swelling and inflammation in case of joints. That's why it is gout, and how it will be removed and management. Progression of the hyperuracemia to gout. First, asymptomatic hyperuracemia. It is a serum urate concentration is greater than 0. mg per dl. The urate crystal may be started from the depend upon the joints, and the evidence there are treatment of the record. And in case of stage 2 acute gout, then asymptomatic to converted to symptomatic, that is called the acute gout. In case of sufficient urate deposit in develop and their joints, and it is a local environment, and some trauma triggers the release of the crystal into the joint space, and inflammatory response occur. These players can self, but they likely to be recurs. This is acute, and this inflammatory condition, it is called trophy, and then it is called calculi, and ultimately the renal stone will be formed. The step or intercranial period, there is a interval between the attack. During these periods, crystal may be still be present at the low level in the synovial tissue and fluids and resulting in the future attack. And stage 4, it is the advanced gout. If the crystal deposited continue to the accumulate, patients may develop chronically still swollen the joints and atrophy, and this advanced stage of gout is relatively uncommon and generally avoided with the therapy. So gout is caused by the under excretion of the uric acid, and diet is rich in the purine and alcohol, and deficiency in the dietary product increase the purine degradation and increase PP synthesis activity. So you can minimize this 4 problem, your gout will be minimized. So overproduction of PRPP increase purine biosynthesis and increase purine degradation and increase uric acid production. And how it will be decreased? The deficiency of HGPRT decrease the AX and G, and the deficiency of GPT accumulation of PPR increase the purine biosynthesis and increase the uric acid level, and deficiency of GPTH on enzyme which is the inhibit the solvage pathway. What is the treatment or management of the gout? How it will be? This is a very simple. First of all, you control your diets. Some diets can aggravate the purine biosynthesis, so you can restrict, like tomatoes, kidney beans, this type of can increase, or another diet which is discussed in later on class. There are so many diets can increase the synthesis of uric acid level in your body. So if your body increases the uric acid level, that diet can be restricted. If cannot be produced, if it is genetically, then how it will be treatment? The first drug of choice for the drug colchicine, which is coming from the Conchica metamnal, which is reduce the inflammation. Another is the allopurinol, which is a good drugs for the gout. Allopurinol, which is inhibitor of uric acid synthesis. Basically, its uric acid is converted to hypoxanthine to xanthine to uric acid, and the enzyme xanthine oxidase is involved in this reaction. The allopurinol inhibit the xanthine oxidase. Low purine diet, this is another factor, and it will be controlled. Other control you cannot be controlled in your body, but diet can be controlled by the body. You can, if you think that food can be controlled, যেমন red meat, orange meat, egg liver, yeast extract, beer, alcohol beverage, asparagus, spinach, bean, pea, lentils, tomato, cauliflower, and mushroom. These are the diet which can restrict it, or you can avoid it to control your uric acid level, and avoid caffeine and alcohol also. Caffeine, which is coming from the tea or coffee, that's tea and coffee must be restricted, and keep hydrated. Another most important factor, if the uric acid level is the high, another process, it will be excreted daily basis. So you can take more amount of water, that water can dissolve the uric acid, and ultimately the uric acid level will be reduced. So 2-3 factors. One is the colchicine drug of choice, allopurinol. Another factors you can control it. First of all, the low purine diet, avoid the caffeine and alcohol also, and another, keep excess amount of chili. In this regards, I think that say that your daily water intake is 3 to 4 liters, but you can excess amount of water, that can be help for the excretion of uric acid. So your uric acid level will be reduced, ultimately gout can be reduced, minimized it. Allopurinol, it is a succinate inhibitor, actually hypoxanthine to allopurinol, and xanthine guanosine hypoxanthine is converted to xanthine to urate, and another xanthine oxidase. And allopurinol is a good drug for the direct inhibition of allopurinol, direct inhibition of xanthine oxidase. If xanthine oxidase is inhibited, then guanosine or hypoxanthine cannot xanthine or xanthine to urate. So allopurinol is the most important drugs, most useful and promising drug for the treatment of gout. and is also called suicide inhibitor used for the gout. Because why it is called suicide? Because allopurinol is a xanthine oxidase inhibitor, but allopurinol when taken by the mouth, it is converted into the liver alloxanthine. This alloxanthine is much more potential inhibitor for the xanthine inhibitor. That's why it is called suicide inhibitor. Actually, allopurinol inhibition activity is much more their metabolic product alloxanthine. Actually, allopurinol which can go to the body after taking by orally, then it is converted to alloxanthine. This alloxanthine is a more potent inhibitor of xanthine oxidase. That's why allopurinol is a suicide inhibitor. So there are some symptoms related to gout. Basically, the swelling of the joints and the sometimes it is called Bengali gete bath. There is some gut joining gulo that will be swelling up. So these are the problem, and accumulation of the titration uric acid in the joints. The gout accumulation of the uric acid salt in the joints. Their movability of the joints will be reduced, and the trophophorus accumulation of the uric acid in the salt of cartilage and the skin. Kidney stone, another problem in case of kidney stone. So please avoid your kidney stone. Uric acid level must be controlled. When the uric acid level present in the high concentration in the blood, it may be precipitated as a salt in the kidney. Or first of all, it is topy, then it is formation of renal calculi, and this salt can form a stone, and which can be cause a pain, infection, and kidney damages. Actually, the kidney stone, first of all the topy, then renal calculi, ultimately the stone formation, and the stone which is inside the kidney, then formation of infection, then pain, immediate pain, and it is a pain that means it is severe pain, and infection, and finally the kidney damage and kidney will be failure. So kidney stone can be prevented by you can avoid this protein low diet of purine, also excretion or water intake, and or if it is or by if stone is formed cannot be excreted in the urine by through urine, then it will be surgery. That is the lithotripsy, one of the procedure by which kidney stone can be removed. The kidney stone, that is the structure. So Lyan syndrome, it is an inherited disorder caused by the deficiency of enzymes hypoxanthine guanosine phosphoribosyl transferase. These are the enzyme. It is present in the birth at the baby. Basically, this is low symptom in 1 lakh per children. Generally seen it is in case of the children. The hypoxanthine and guanine are not used in the salvage pathway of purine nucleotide, and hypoxanthine and guanine are not utilized repeatedly by the converted into the uric acid. So symptoms of Lyan syndrome in the Lyan syndrome is severe gout in case of children, and severe mental and physical problem, and self multi-lightening behavioral pattern. So thank you all the listeners. You're listening my lecture, and all please, if you understand, there is no problem, like it. If any question, please comment our comment box. Thank you all the listeners.